Before watching this video, I want you to go ahead and watch my lecture on thanatology, because that video is kind of like a trailer for this video where I have taught you everything that you need to know about death. Once you grasp that concept about death, you can move ahead and learn about the changes that take place in human body after death. And the changes that take place in human body after death is post-mortem changes. And on the basis of when these changes are seen after death, we have divided these post-mortem changes into three types, namely immediate changes, early changes, and late changes. Immediate changes are as a result of clinical death or somatic death or systemic death. Early changes are as a result of cellular death or molecular death. And late changes are as a result of decomposition. And if you are wondering what clinical death is, what cellular death is, again, I have taught you everything that you need to know about death under the topic of thanatology. Go ahead and watch that lecture. Immediate changes are seen within matter of minutes after death. Early changes are seen within matter of hours to days after death. And late changes are seen weeks to months to sometimes even years after death. Immediate changes include number 1, cessation of brain function. Number 2, cessation of circulation. And number 3, yes, you might have already guessed, cessation of respiration. The definition of death itself, the triangle, the cessation of brain function, cessation of circulation, and cessation of respiration. See, the cessation of brain function leads to loss of voluntary control over body plus insensibility. And this is the very first change that is seen after death. On the other hand, early changes include number 1, skin changes, number 2, eye changes, and 3 mortes. What? 3 mortes. Mortes, mortes, mortes. First one being algor mortis, then livor mortis, then rigor mortis. And yes, they are in sequence. Algor mortis is nothing but post-mortem chilling or cooling of body. Livor mortis is post-mortem staining or hypostasis of body. Rigor mortis is post-mortem rigidity or stiffening of body. Onset. Algor mortis is seen 15 minutes after death. Livor mortis is seen times 2, that is 30 minutes after death. And rigor mortis is seen again times 2, that is 60 minutes after death. What about late changes seen due to decomposition? So you have autolysis, where there is decomposition by the chemicals of one's own body, lysosomal enzymes. Putrefaction, adipocere formation, and mummification. So these are the changes that you need to know. Post-mortem changes are divided into immediate change, early change, and late change. Immediate change includes cessation of brain function that leads to loss of voluntary control and insensibility, cessation of circulation, and cessation of respiration. Early changes include skin changes, eye changes, and 3 mortis, namely algor mortis, livor mortis, and rigor mortis in that particular sequence. And the late changes are seen due to decomposition, including autolysis, putrefaction, adipocere formation, and mummification. Now, immediate changes I have already taught in detail under thanatology. So I want you to go ahead and watch that video if you want to learn everything about immediate changes, where I have taught you everything related to cessation of brain function, about brain death, coma versus brain death, brain stem death versus cortical death, everything about circulation and respiration, and the tests and examinations that can be done to test for brain death, test for cessation of circulation, test for cessation of respiration. So go ahead and watch my video on thanatology. With that being said, we are going to start post-mortem changes from early changes. So again, early changes are due to cellular death, that is death at the level of cell itself, and it is seen in a matter of hours to sometimes for some days. The first change is skin changes, and under skin we can appreciate two changes. Number one, since there is cessation of circulation, the skin is obviously going to be pale. So pallor due to cessation of circulation. Not only that, there is also loss of elasticity of skin. But way more important for exam point of view as compared to skin changes are your eye changes. And just to make it simple for you guys, what I have done is that kept the eye changes number one in sequence and number two in the form in the basis of the structures of the eye. So first the changes are seen in retina, then the changes are seen in intraocular pressure, then the change is seen in cornea, then the change is seen in sclera. To be more specific, changes are first seen in retinal vessels. So right after death, there is cessation of circulation. Due to cessation of circulation, there is reduced blood supply to the retinal vessels as well. As a result, when you use an ophthalmoscope to carry out fundoscopy and look behind the eye in the retina, normally you would see retinal vessels that are continuous like this, right, on the retina behind the eye. But in case of death, right after death, due to cessation of circulation, the vessels due to lack of blood becomes fragmented. Why? Due to lack of blood becomes fragmented. There is fragmentation due to cessation of circulation. Since cessation of circulation takes place within matter of minutes, the fragmentation of retinal vessels also takes place within matter of minutes. And this is given a specific name called Kevorkian sign or cattle tracking sign or railroad sign. You can see right here, this is the retina. I've used an ophthalmoscope to look at it. The blood vessels normally are continuous, but due to cessation of circulation after death, there is fragmentation of the blood vessel, and this is referred to as Kevorkian sign or cattle tracking sign or railroad sign. Second is intraocular pressure, which decreases from 20 mm of Hg to 0 mm of Hg within 2 hours. Third is cornea. The cornea, which is transparent, becomes hazy and eventually opaque. It becomes hazy after 1 hour of death and opaque after 6 hours of becoming hazy. Sclera, which is the white part around the cornea, the sclera shows triangular opacities on either side of cornea. That is, if this is your eye, here's the cornea. On either side of cornea, the sclera shows triangular opacities. And these triangular opacities are as a result of dust deposition plus drying. Obviously, dust is going to deposit only if the eyes are open after death. And this has also been given a specific name, that is tachynoer sclerotica. And you know very well, I am not gonna just leave you just like this. We are gonna revise all of that with the help of diagrams or the pictures or whatever. First one, what you see is the fragmentation of retinal vessel, referred to as Kevorkian sign, seen within matter of minutes due to cessation of blood circulation. Second you are looking at is corneal opacity, seen 6 to 7 hours after death. And third you are looking at is the triangular deposition on either side of the cornea over the sclera due to deposition of dust and drying of the eye. That is only if eyes are open after death. And this is referred to as tachynoer sclerotica. So those are your eye changes. After eye changes, you have the three mortis: algor mortis, livor mortis, and rigor mortis. Starting off with algor mortis. Algor mortis is nothing but post-mortem chilling or cooling. It is seen 15 minutes after death. The progression can be appreciated with the help of a graph between body core temperature and the time. So let's say the body core temperature at the time of death was somewhere here, and after 15 minutes of death it starts to fall. It falls in three phases: slow fall, rapid fall, and again a slow fall. 1, 2, 3. So there's a slow fall, a rapid fall, and then again a slow fall, giving us a sigmoid graph. The mechanism for loss of temperature after death is due to loss of heat by conduction, by convection, and by radiation, evaporation, everything. The rate. See, the rate depends on various factors, but on average, the rate at which the body temperature falls after death is 0.4 to 0.7 degrees Celsius per hour. However, it depends on various factors such as: number 1, body covering. If at the time of death the body is covered by thick piece of clothing, obviously the drop or the fall in temperature is going to be slow. Location of the body. Let's say a body is in a water body inside a lake which is quite cold, then obviously the fall in temperature is going to be much faster. Number 3, season. In a winter season, the fall in body temperature is going to be faster as compared to summer season. Environment, the same thing again. Whether the body is in desert or in glacier, the fall in temperature is going to matter on the basis of the environment in which the body is found. So the fall in temperature is that of the body core temperature, which you can measure with the help of: number 1, a clinical thermometer, which is also referred to as a thanatometer, which is around 25 centimeter in length, or a thermocouple, which is much more advanced, and it can be measured at: number 1, ideally subhepatic space, but most commonly in the rectum. Other locations are the lower part of esophagus and the middle ear or the tympanic membrane. Middle ear / the tympanic membrane. So the significance of algor mortis is that it gives us the time since death. How? You can calculate it using normal body temperature minus the rectal temperature at that time divided by the rate of fall of temperature, the rate of fall in temperature. This is simply your unitary method. If you apply basic maths, you will get this formula. Then you have something called post-mortem caloricity. As I said, after death, there is fall in temperature of the body, but in certain scenarios, the body remains warm even after death for the next 1 to 2 hours. When can it be seen? Simple logic. If the body was hot at the time of death, again by hot I mean the body core temperature was high at the time of death itself, obviously it's going to remain warm for the next few hours. You can see that seen in number 1, impaired heat regulation, as in heat stroke and pontine hemorrhage. Number 2, increased body core temperature due to convulsions as seen in tetanus and strychnine poisoning. And number 3, infection as in case of septic shock. And see, does burn lead to postmortem caloricity? And the answer is no, because burn leads to increase in body surface temperature, not body core temperature. With that, we are done with algor mortis as well. Let's revise. Algor mortis is post-mortem cooling or chilling of the body. That is, after death, the body cools down. Number 2, it is appreciated 15 minutes after death. Number 3, the fall in body temperature first is slow, then rapid, and then again slow, giving us a sigmoid graph when plotted between body core temperature and time. The mechanism by which the temperature decreases is loss of heat by conduction, convection, radiation, evaporation. The rate at which the body core temperature drops is on average 0.4 to 0.7 degrees Celsius per hour. However, it depends on various factors such as the piece of clothing, how thick it is at the time of death around the body of the victim, location of the body itself, season at the time the body is found, environment in which the body is found. Body core temperature can be measured using a clinical thermometer, often referred to as thanatometer, which is around 25 centimeter long, or a thermocouple, which is much more advanced. The location at which the temperature is taken ideally is subhepatic space, but most commonly is the rectum. Other spaces are the lower part of the esophagus and the middle ear or the tympanic membrane. The time since death can be calculated with the help of formula: normal body temperature minus rectal temperature divided by rate of fall in temperature. Post-mortem caloricity is when the body remains warm for the next few hours even after death. It is seen in number 1, impaired heat regulation as seen in heat stroke and pontine hemorrhage, increased body core temperature due to convulsions as in tetanus and strychnine poisoning, infections such as septic shock, but it is not seen in burn, because in burn there is increase in body surface temperature and not body core temperature. After algor mortis, we have livor mortis. Algor mortis was post-mortem chilling of the body. Livor mortis is post-mortem staining of the body. Here there is pooling of blood in dependent part of body after death due to gravity. So this depends on the position of body after death. For example, after death, a body is kept in supine position. Then the dependent part of the body is the back of the body, that is behind the head, behind the back, behind the buttocks and behind the leg. So due to gravity, the body gets pulled and collected behind the body. That is livor mortis, which is also referred to as post-mortem staining or post-mortem hypostasis or sugillation or cogitation or post-mortem lividity or cadaveric lividity. Mechanism. The mechanism is explained by the definition itself, and from the definition we now know that it is dependent on the position of the body. Post-mortem staining is dependent on the position of the body. So it is the position of the body that determines post-mortem staining. So let's look at few examples. Let's say after death the body is in supine position, then the dependent part of the body is behind the body, and that is where you will observe post-mortem staining. Let's say after that the body is in prone position, so the dependent part of the body is the front of the body, and that is where post-mortem staining will take place. Let's say after death the body is vertical, like in case of hanging, the body is vertical to the ground. So in that case the pooling of the blood will take place in hand and feet, giving us glove and stock post-mortem appearance. The post-mortem staining, glove and stocking, glob and stocking, post-mortem staining. Let's look at these diagrams to understand what I have said right now. So here the body is in supine position after death. The dependent part is the back. So that is where the blood has collected, and that is where you can see the post-mortem staining. The body is in prone position after death, and the dependent part is the front. So that is where the pooling of blood has taken place and post-mortem staining has taken place. The body is in left lateral decubitus after death. So the dependent part is the left lateral part of the body, and that is where the blood has collected, and that is where post-mortem staining is there. Now there are exceptions. Basically, these exceptions are the conditions where post-mortem staining does not take place. Number 1, rolling of dead body. Let's say after death the body is left in a high flow river. You have a very high speed flowing river, and then you leave the body there. With the flow of the river, the body keeps on rolling. As the body keeps on rolling, the blood inside the body continuously moves as well. As a result, it doesn't get time to pool. It does not get time to pool and get collected at a certain region. Second is anemia, and third is hemorrhagic shock. In these two conditions, the amount of blood in the body is so less that it is not enough for post-mortem staining. In these conditions, too less blood for staining to take place. In this condition, continuous movement of the blood. So blood is unable to fix. The blood is unable to collect or pull down. Progression. So it starts 30 minutes after death. It is seen 4 hours after death, and it becomes a maximum 6 to 12 hours after death. It fixes 8 hours after death. What is fixation? See, here is your body in supine position, due to which the gravity pulls all the blood of the body behind at the back of the body. So here is the pulling of the blood or post-mortem staining. But if you switch the position of the body from supine to prone, now the gravity will pull all that blood again to the front of the body, because now the new dependent part of the body is the front of the body. So the post-mortem hypostasis will change. But after 8 hours, even if you change the position of the body, the location of post-mortem hypostasis will not change because it is fixed. That is, after 8 hours of death, the post-mortem hypostasis becomes fixed. So even if you change the position of this body from supine to prone, it will still be, post-mortem stasis will still be in the back of the body. It will not shift to front of the body. How can you check for fixation? That is with the help of blanching. In blanching, you simply press over the site of collection of blood. So when you press over it, the blood will get pushed to the periphery. As a result, there is central pallor. You see that central pallor? See again. There is central pallor because the blood in the capillaries get pushed to the periphery. So if fixation does not take place, that means the blood can be shifted to the periphery. But once the fixation takes place, no matter how much pressure you apply, the blood will not shift to the periphery because it is fixed at its position. So you apply blanching. If blanching positive, that means fixation has not taken place. If blanching negative, means fixation has already taken place. After that, contact pallor. Contact pallor are those areas where post-mortem staining does not take place, and that is because of increased pressure at these areas, and these increased pressure are as a result of tight clothing or simply pressure points. For example, let's say at the time of death, someone was wearing a very tight neckband. As a result, no matter the position, the collection of blood will not take place at that tight neckband because it is continuously pressing over the neck, over the blood vessels underlying that region. So blood will not pull, it will be continuously pushed away. Similarly, let's say our body is in supine position, then there are parts behind the body which is in continuous contact with the floor. And at those parts, since the body part is being continuously pressed, pooling of the blood at those parts will not take place. So it can either be due to tight clothing. Another example could be a brass strap or just a strap around the shoulder, and at that strap area again collection of blood will not take place because that strap is continuously pressing over the skin, pressing over the capillary, not allowing for the blood to pool at those areas. Pressure point could be, for example, in supine position, the occiput, the shoulder, sorry, the oh god, where did you go? Where did you go? Here it is. The scapula, the buttocks, and the calf. You can see right here. So the pressure points on this body are the occiput, the scapula, the buttock, and then the calf. And at those points, post-mortem stasis does not take place. Depending on the color of hypostasis, see, normally the color of post-mortem hypostasis is bluish purple, okay, but in certain poisoning the color might be different, and here's the list which you can mug up on your own. What about medico-legal importance? Number 1, it gives time since death. Number 2, it gives the position of the body at the time of death. And number 3, depending on the color of post-mortem hypostasis, you can also determine the cause of death by poisoning. If the death is by poisoning, you can determine what type of poisoning led to death depending on the color of the hypostasis. So with that, you are also done with livor mortis. Let's revise livor mortis. Starting off with the definition. So livor mortis is the pooling of the blood in the dependent part of the body after death due to gravity. It is also known as post-mortem staining or post-mortem hypostasis or suggulation or cogitation or post-mortem lividity or cadaveric lividity. The mechanism is the same as I have explained in the definition. That is, post-mortem staining is dependent on the position of the body. For example, after death, if the body is in supine position, the dependent part is the back of the body and post-mortem staining takes place behind the body. After death, if the body is in prone position, then the dependent part is the front of the body, so the post-mortem staining takes place in front of the body. After death, if the body is vertical, then the dependent part is the hand and foot, and that is where the post-mortem staining takes place, referred to as glove and stocking post-mortem staining. Progression. So onset is at 30 minutes, seen at 4 hours, and maximum at 6 to 12 hours. At 8 hours, it becomes fixed or fixation takes place, which can be determined by blanching. If there is blanching, that means fixation hasn't taken place. If there is no blanching, that means fixation has taken place. Post-mortem, there are certain parts in the body where post-mortem staining does not take place, and those parts are the areas where there is high pressure being applied over the skin. The high pressure can either be due to tight cloth like a neckband or a brass strap, or due to pressure points like in supine position. The pressure points are the occiput, scapula, buttock, and calf. Similarly, there are exceptions to post-mortem hypostasis. If the body is continuously moving, like in rolling condition, then the blood inside the body is also continuously moving and it does not have time to get collected at a certain place, and it does not result in post-mortem hypostasis. Another, in case of anemia and hemorrhagic shock, there is so less blood that post-mortem hypostasis does not take place. Depending on the color of hypostasis, you can also determine the type of poisoning that took place, that took the life of the victim. And the medical legal importance of post-mortem hypostasis are: number 1, you can determine the time since death. Number 2, you can determine the position of the body at the time of death. And number 3, if the death is by poisoning, depending on the color of post-mortem hypostasis, you can determine the type of poisoning that took place. First, we had algor mortis, where we saw post-mortem chilling of the body. Second, livor mortis, where we saw post-mortem hypostasis. Third, we have rigor mortis, which is post-mortem rigidity or stiffening of the body. It starts 60 minutes after death. The mechanism is ATP depletion. That is, after death, the level of ATP in the muscle decreases, and when it hits a certain level, the muscle becomes stiff. The progression: right after death, first thing that is present is a primary relaxation. The body muscles are relaxed because there is 100% ATP in those muscles. But after a while, there is post-mortem rigidity. Because as time passes, the level of ATP in the muscle, it depletes. When it depletes to around 85% of total ATP, the onset of post-mortem rigidity takes place. And when it depletes to around 20% of total ATP, maximum post-mortem rigidity takes place. Then there is secondary relaxation. That is because eventually decomposition takes place, and that decomposition results in breakdown of muscle protein. Breakdown of muscle protein. So there is primary relaxation right after death due to the presence of 100% ATP in the muscle. As time passes, the ATP depletes, and when it hits 80% of 85% of total ATP, there is onset of postmortem rigidity. When it becomes 20%, there is maximum rigidity, and then as time passes, decomposition starts, which breaks down the muscle proteins, and the muscles, they become lax, resulting in secondary relaxation. Primary relaxation, postmortem rigidity or rigor mortis, and secondary relaxation. Then we have rules of progression that gives us even better idea about the progression of postmortem rigidity. We have the rule of 12. According to rule of 12, first there is primary relaxation. See, what I'm going to do is take this progression and elaborate it even more under rule of 12. So first there is primary relaxation when there is 100% ATP in the muscle. Then after 60 minutes, there is post-mortem rigidity, because I have already taught you the onset of post-mortem rigidity is 60 minutes after death, and this is when onset takes place. At the time of onset, you have 85% of total ATP. Now the rule of 12 applies. After the next 12 hours, the ATP falls down to 20%, and this is when the rigidity is maximum. It remains maximum for the next 12 hours, and then it resolves in the next 12 hours. Resolves in the next 12 hours. Again, so what have I mentioned? I have said that right after death, there is primary relaxation due to the presence of 100% ATP in muscle. 60 minutes after death, the onset of postmortem rigidity takes place because the fall in ATP goes down to 85% of total ATP. Then after the next 12 hours, maximum rigidity takes place because ATP falls down to 20% of total ATP. For the next 12 hours, it remains maximum. And then after that, in the next 12 hours, a resolution takes place that the muscle again becomes relaxed. Nisten's rule. Nisten's rule tells us that post-mortem rigidity takes place in involuntary muscle way before voluntary muscle. And even in involuntary muscle, very first is myocardium, and even in voluntary muscle, the very first is the eyelid. So if someone asks you the very first muscle where postmortem rigidity takes place, that's myocardium. The very first voluntary muscle where postmortem rigidity takes place, that's eyelid. The order of progression as well as the order of resolution of postmortem rigidity as per Nisten's rule is a descending, that is from top down. That is from top down. Let me show you the order. So first, it's obviously the involuntary muscle or the myocardium that becomes rigid. Then the eyelid becomes rigid. Then the neck becomes rigid. Then the jaw becomes rigid. The lower jaw becomes rigid. Then the facial muscle becomes rigid. Facial muscle becomes rigid. Then the thorax becomes rigid. And then the upper limb, and then the abdomen, and then the lower limb, and then finally fingers and toes. Fingers and toes. So from proximal, it goes to distal as well. Descending, proximal to distal. So this is important. This particular series is important because when you are in your post-mortem dissection hall, you will be asked to check for post-mortem rigidity. And obviously, while checking for it, you don't just go for the random joints. You start with the eyelid, then go to neck, and then the lower jaw, and then the facial muscles, and then you shift to thorax, upper limb, abdomen, lower limb, and then the distal fingers and toes. Shapiro rule. Now, Shapiro rule is quite different. According to Shapiro, post-mortem rigidity starts simultaneously in all muscles. According to him, it is a physicochemical process, and in such a process, all muscles are involved simultaneously. But it depends on the bulk of the muscle. That is, if the bulk of the muscle is more, that means there is more ATP in the muscle. And I said earlier that post-mortem rigidity depends on the level of ATP in the muscle, because it is after the ATP depletes to 85% that post-mortem rigidity starts. So if there is too much ATP, for it to deplete to 85%, it will take a longer period of time. So if there is more bulk, there is more ATP, there is going to be late onset of post-mortem rigidity. On the other hand, if the bulk is less, that means the ATP is less, that means the depletion in ATP will be quick and there will be early onset. That is Shapiro rule. So with that rule of progression, you learnt about rule of 12, Nisten's rule and Shapiro rule. Next, factors affecting onset and duration. There are various factors that affect the onset and duration of post-mortem rigidity. These factors include age, muscle bulk, environment, and the nature of death. Starting with age. Less than 7 months of intrauterine life, no rigor mortis takes place. That means, let's say there is stillbirth or a dead born baby preterm, that is less than 7 months old. Then in that case, that baby after death will not show rigor mortis. Term stillborn shows a rigor mortis, because a term stillbirth is 9 months old and 9 months is greater than 7 months. So obviously there is going to be rigor mortis. In children and old age, the rigor mortis is feeble but quicker. In adult, there is slow onset rigor mortis, but it is more pronounced, and not only that, it stays longer as well. Rigor mortis depends on muscle bulk as well. If the bulk is more, ATP is more, it is going to have late onset. The depletion is going to be low. The depletion is going to be slow. If there is less bulk, there is less ATP, and it will have early onset because the depletion is going to be fast. It depends on environment. If there is hot environment, more breakdown of muscle will take place and rigor mortis will have an early onset. But it will pass away quicker as well. That is quick disappearance. Disappear early as well. If the body is in cold environment, there is less breakdown of the muscle, so late onset of rigor mortis plus disappear late as well. So in hot environment, there is early onset and disappears early as well. In cold environment, there is late onset and disappears late as well. Nature of death. Now, depending on the nature of death, we have early onset rigor mortis and late onset rigor mortis. Early onset rigor mortis can be seen in violent death, because in violent death, the person is filled with emotion, and due to emotion, there is faster rigidity of the muscle. Chronic wasting disease, there is already less ATP at the time of death itself. If there is already less ATP at the time of death, then the depletion of ATP is faster. Strychnine poisoning and tetanus leads to convulsions, and convulsions leads to use of ATP. So there is depleted ATP at the time of death itself. So there is early onset rigor mortis. Heat stroke and cyanide poisoning also leads to early onset rigor mortis. Late onset rigor mortis is seen in asphyxia, pneumonia, and hemorrhage. Differential diagnosis. Rigor mortis may be confused with number 1, heat stiffening. Heat stiffening takes place when the body core temperature is greater than 65 degrees Celsius. This leads to coagulation of muscle protein. And it is due to the coagulation of muscle protein that stiffening of the muscle takes place. This results in pugilistic or fencers or boxers attitude, which you will learn about under heat injury. Number 2, cold stiffening. In cold stiffening, due to freezing of joint fluid, due to freezing of joint fluid, the joints they become stiff. Number 3, gas stiffening. In gas stiffening, due to accumulation of gas inside the body after decomposition, the body becomes stiff. And finally, cadaveric spasm. Cadaveric spasm. Cadaveric spasm. Really important topic on its own. Before cadaveric spasm, let's revise the whole rigor mortis once. So the definition of rigor mortis is it is post-mortem rigidity of the body. Onset is at 60 minutes. Mechanism is depletion of ATP. Progression is right after death there is primary relaxation due to 100% ATP in muscle. As time passes, the ATP depletes and decreases to 85% when the post-mortem rigidity is first seen, and it becomes maximum when the ATP depletes to 20%. Then there is secondary relaxation due to decomposition that leads to breakdown of muscle protein. Rule of progression, first is rule of 12, where primary relaxation when there is 100% ATP. After 60 minutes, there is onset as ATP depletes to 85%. Then after 12 hours, there is maximum when ATP depletes to 20%. And then it remains maximum for the next 12 hours. And then in the next 12 hours, resolution takes place. Nisten's rule says that the rigidity of involuntary muscle occurs before voluntary muscle. So the first muscle that goes through postmortem rigidity as per Nisten's rule is myocardium, and the first voluntary muscle that goes through postmortem rigidity as per Nisten's rule is eyelid. The order of progression as well as the order of resolution both is a descending, and the order includes first the involuntary muscle like myocardium, then eyelid, then neck, then lower jaw, then facial muscle, then thorax, then upper limb, then abdomen, then lower limb, and then the distal fingers and toes. According to Shapiro, the process of postmortem rigidity is a physicochemical process. It starts in all the muscles at once simultaneously, but it depends on the bulk of the muscle. If the bulk of the muscle is more, it has more ATP, so the depletion of ATP takes more time, so there is late onset postmortem rigidity. On the other hand, if the bulk of the muscle is less, there is less ATP, so the depletion of ATP is faster, so there is early onset postmortem rigidity. Now, there are various factors that affect the onset and disappearance of postmortem rigidity. They are age, muscle bulk, environment, and the nature of death. Number 1 is in less than 7 months old intrauterine live baby, postmortem rigidity does not take place. But in a term baby that has burned dead, postmortem rigidity can be appreciated because a term baby is 9 months old, which is greater than 7 months. In children and old age, the postmortem rigidity is feeble and quicker. In adult, the postmortem rigidity has a late onset, but after it onsets, it is much more pronounced and stays longer. Muscle bulk, more ATP, late onset. Less bulk, less ATP, early onset. Environment, hot environment, there is more breakdown of muscle, so there is early onset and it disappears early as well. Cold environment, there is less breakdown of muscle, so it has late onset and it disappears late as well. Nature of death, early onset rigor mortis is seen in violent death due to emotion. Chronic wasting disease because there is reduced ATP at the time of death itself, strychnine poisoning and tetanus because it leads to convulsions and there is reduced ATP at the time of death itself, heat stroke and cyanide poisoning. Late onset rigor mortis is seen in asphyxia, pneumonia and hemorrhage. Differential diagnoses are heat stiffening where the body core temperature is greater than 65 degrees Celsius, which results in coagulation of muscle protein, giving not just the body core temperature, the body temperature, because this is seen in burn as well, leads to coagulation of muscle protein, giving a pugilistic or fencers or boxers attitude. Cold stiffening is when there is freezing of the joint fluid, which leads to rigidity at the joint or stiffening at joint. Gas stiffening is as a result of accumulation of gas within the body after decomposition. And finally, there is cadaveric spasm. Very important topic is cadaveric spasm, which is sometimes misinterpreted as post-mortem rigidity or rigor mortis. What is cadaveric spasm and how is it different from rigor mortis? Cadaveric spasm is also referred to as instantaneous rigor or cataleptic rigor. In cadaveric spasm, there is sudden contraction of small group of voluntary muscle that was in use at the time of death. In rigor mortis, there is contraction of all the muscles in the body, either in a sudden progression as per Nisten's rule or simultaneously, but depends on the bulk as per Shapiro's rule. But in cadaveric spasm, only a small group of muscle is contracting. In rigor mortis, the contraction of the involuntary muscle and the voluntary muscle, both of them take place. And as per Nisten's rule, contraction of involuntary muscle takes place before voluntary muscle. In cadaveric muscle, the contraction of small voluntary group of muscle that was in use at the time of death takes place. In rigor mortis, the contraction is not sudden. First, there is primary relaxation when there is 100% ATP in the muscle. Then the level of ATP depletes to 85% after 60 minutes, and it is after 60 minutes that there is onset of postmortem rigidity. But in cadaveric spasm, the contraction is sudden. At the time of death itself, there is no primary relaxation. Cadaveric spasm deals with the emotion of the person at the time of death. For example, let's say I am drowning. At the time of drowning, I am in a desperate situation. I'm desperately trying to come out of that situation. I'm in a fight or flight situation. My sympathetic activity is active. I'm trying to hold on to whatever I can find so that I can pull myself out of that desperate situation. I'll try to grab onto grass, grab onto mud. If I grab onto grass and mud, I'll clench it so tight that I will not let it go, because that's the only support I have in such a dire situation. So I'll clench hard on it. And after death, when the police will find my body, they will find that I'm holding onto that piece of grass and my hand muscles are contracted. That is due to a emotional, dire, desperate situation at the time of death. Or you might have seen in movies or anime where the hero, swordsman, they even at the time of death, they strongly hold onto their sword and do not let it go, because they are clenching so hard on that sword that at the time of death, sudden contraction of that group of voluntary muscle takes place, cadaveric spasm takes place, they do not let go of that sword. Or maybe at the time of suicide, when you are shooting yourself with the gun, due to that emotion building up inside of you, hold the gun so tightly that even after shooting yourself, you are still holding onto that gun, right? And this can't be fabricated. You can't get a dead body and try to make that dead person hold a sword, hold tightly onto grass, hold tightly into gun. It can't be fabricated. And that is why it is an anti-mortem finding. And that's your cadaveric spasm. And with that, we are done with early findings of early postmortem changes. The late changes seen in human body after death is divided broadly into two: late changes due to decomposition and late changes due to modified decomposition. The difference between the two is that in decomposition there is dissolution of the body, breakdown of soft tissue. But in modified decomposition, there is actually no decomposition. Your body, the dead body, is being preserved from being decomposed. If decomposition takes place on its own, that's self-decomposition. If it takes place with the help of bacteria, that is bacterial decomposition. Self-decomposition is also referred to as autolysis, and bacterial decomposition is also referred to as putrefaction. Now, be it autolysis, putrefaction, at the end of the day, what we receive, what the dead body eventually amounts to is skeleton, and this is referred to as skeletonization. The skeleton either dissolves or is preserved in the form of fossils. Modified decomposition: the body is preserved from being decomposed either by the formation of adipocere, referred to as adipocere formation, which takes place in moist climate, or it is preserved from being decomposed by the process of dehydration in hot and dry climate, which is referred to as mummification. Mummification. So under late changes, we are going to learn in detail about autolysis and putrefaction, which are your decomposition, and adipocere formation and mummification, which are your modified decomposition or preservations. Starting off with autolysis. What is autolysis? Definition. Autolysis, as I said earlier, is self decomposition. Number 2, how does this process of self decomposition take place, or mechanism? See, soon after death, the cells of the dead body, they start releasing lysosomal enzymes. And these lysosomal enzymes are responsible for the breakdown of protein, breakdown of carbs, and breakdown of fat, the three major building blocks of our body, which eventually leads to breakdown of soft tissue and decomposition. This brings about various changes in the body. And the very first change or the very first sign of autolysis is clouding of cornea. Remember, the very first sign of autolysis is clouding of cornea. With that, autolysis is done. Second is putrefaction. If autolysis is self-decomposition, putrefaction, on the other hand, is decomposition by bacteria or bacterial decomposition. So how exactly does bacteria lead to decomposition of dead body? That is, what is the mechanism behind it? Here's the mechanism. See, very easy. After death, there is cessation of respiration. You know this one, right? In the immediate changes, there is cessation of respiration. Due to cessation of respiration, there is reduced oxygen in tissue, creating an anaerobic condition, anaerobic environment. And this is a favorable condition for bacterial growth. So, after death, a favorable condition for bacterial growth is created in the dead body. So, now you have the favorable environment. But then for decomposition to take place, you need bacteria. Where does this bacteria come from? This bacteria come from either from within the body, that is gastrointestinal tract or respiratory tract, where you will find commensal bacteria, right? Either commensals, or from outside the body through wound infection. These bacteria, they enter the tissue, they multiply, they grow, and they release bacterial enzymes. These bacterial enzymes do the same thing as that of lysosomal enzymes. That is, they break down protein, carbs, and fats, the three major building blocks of the body, and then they break down the soft tissue, leading to decomposition. Here, since the decomposition or the breakdown of soft tissue is taking place by bacterial enzyme, we call it putrefaction. There, it was taking place by lysosomal enzymes, called self-decomposition or autolysis. Okay, so bacteria is responsible. Wow. Which bacteria are responsible then? What's the etiology? See, there are many bacteria within the GIT, many bacteria within the respiratory tract, many bacteria that enter through the wound, but then out of them all, the most important is Clostridium welsii. Remember, the most important of them all is Clostridium welsii. The reason being, Clostridium welsii produces lecithinase. This lecithinase, it breaks down, hydrolyzes lecithin, and lecithin is a major component of plasma membrane of all the cells. So if lecithin gets destroyed, plasma membrane of cells get destroyed and the cell itself gets destroyed. If plasma membrane of red blood cells get destroyed, it leads to hemolysis. So Clostridium welsii is responsible for causing hemolysis. You have other causative agent as well, such as Staphylococcus, Streptococcus, bacteroids, and diphtheroids. But then remember, out of them all, the most important is Clostridium welsii. You got that right. Okay. Next, in bacterial decomposition or putrefaction, various changes take place in the body, and these changes are broadly classified into three. You have color change that take place. Number two, you have evolution of gas or gas production that takes place. And number three, necrosis by liquefaction that takes place. Liquefactive necrosis. Liquefactive necrosis, also referred to as colliquative necrosis. All three, color change, gas production, and liquefactive necrosis, are as a result of bacterial activity and bacterial enzymes. Starting off with color change. See, under these three headings, you are going to find lots and lots of changes, but trust me, if you listen to me for the next 10 minutes, I'll make sure that you'll have all the changes mocked up. I will make sure that they are mocked up and they're set in your brain. How I'm going to proceed is that I'll give you all the theory and then revise the theory again with the help of diagrams. And once you have those diagrams in your brain, I assure you, you'll remember all the changes. Okay, so first you have color change. Color change, it can either be internal color change or the color change that is appreciated outside the body, or external color change. I'm talking about the dead body going through decomposition or putrefaction, okay? The very first internal color change is appreciated in the intima of the arteries, more specifically the aortic intima. And the change in color is that the aortic intima becomes reddish brown. Reddish brown. I'll show you the diagram, hold your horses. Externally, the very first color change that is appreciated is in the right iliac fossa, where it becomes green in color. Green in color. So what is the mechanism behind greenish discoloration of the body in a decomposing dead body? Because when you go in a post-mortem hall, dissection room in your medical college, you will be able to appreciate greenish discoloration throughout the body. What is the mechanism behind greenish discoloration of the tissue in a dead body? This is the mechanism. See, very easy, very easy. It is very easy. Mechanism. At the time of decomposition, bacterial activity is at its peak. And the most important bacteria, as I mentioned earlier, is Clostridium welsii, which produces, what does it produce? It produces lecithinase. Lecithinase is responsible for hemolysis. Due to hemolysis, there is breakdown of RBC. And from within the RBC, what comes out? Hemoglobin leaks out. Now, there are bacteria in the gut, right, causing hemoglobin to leak out of hemolyzed RBC. And within the gut, there are also gases like methane and hydrogen sulfide. This hemoglobin will combine with methane and hydrogen sulfide to form sulf-meth-hemoglobin. Sulf-meth-hemoglobin. Sulf from hydrogen sulfide, meth from methane, and hemoglobin is the hemoglobin itself. This sulf-meth-hemoglobin is green in color, which if it deposits in overlying tissue, will lead to greenish discoloration of the tissue, like the greenish discoloration of the complete abdomen, right? But if the same sulf-meth-hemoglobin will go and deposit in wall of superficial blood vessels, then this leads to tree-like phenomenon called marbling. Again, I'll show you all the pictures. Just hold this information in your brain for a while. The greenish discoloration is seen in summer around 12 to 18 hours after death, and in winter around 1 to 2 days after death. Very easy. You have 12 hours, multiply by 2, 12 to the 24, 1 day. So in summer 12 hours, in winter 1 day. Eventually, the hemoglobin, it is going to get broken down as well, and it will get broken down into its components, heme and globin. And what is heme made up of? It is made up of iron. The iron gets snatched out. The iron can also go and combine with hydrogen sulfide, forming ferric sulfide. This ferric sulfide is black in color, and if this ferric sulfide will go and deposit in the overlying tissue, the tissue which was green in color eventually becomes black in color. It was green in color due to sulf-methemoglobin, then it becomes black in color due to ferric sulfide. So those are all the color changes. Now time for revision with the help of diagrams, as I assured you, as I told you. Okay, let's go. What is this? This is the first internal color change seen in putrefaction. Where is it seen? It is seen in aortic intima. What kind of color change is there? It becomes reddish brown. What is this? This is the very first external color change due to putrefaction. Where is it seen? It is seen in the right iliac fossa. What is the change in color? There is greenish discoloration. So as I said earlier, okay, I'll tell you again. What is this? There is greenish discoloration of abdomen. Why is it? What is it because of? It is because of sulf-meth hemoglobin. Okay. See, eventually the greenish discoloration is that of the complete abdomen and then that of the complete body. But the greenish discoloration starts at right iliac fossa. Why? Why is there greenish discoloration? The greenish discoloration is because of sulf-methemoglobin. How is sulf-methemoglobin formed? It is formed due to bacterial activity. Just below right iliac fossa is the cecum, and the cecum, I repeat, the cecum shows maximum bacterial activity. So this is where sulf-methemoglobin is produced first and at a maximum amount, and that is why just above the cecum, the overlying tissue is that of a right iliac fossa, and that is where the greenish discoloration is appreciated first. Again, below the right iliac fossa is the cecum. In the cecum, there is maximum bacterial activity which produces lots of sulf-methemoglobin. So sulf-methemoglobin will go and deposit in the overlying tissue, that is the tissue of the right iliac fossa, causing the greenish discoloration of right iliac fossa first. If the same sulf-methemoglobin, instead of depositing in the tissue, will deposit in the wall of the peripheral vessels, it leads to, yes, marbling. This tree-like marbling throughout the body. And eventually, iron comes out of the hemoglobin forming ferric sulfide, and this leads to black discoloration of the complete body. So these are the various color changes. So after color change, we have gas production. Even though I just taught you color change first and then I'm teaching gas production, that does not mean that color change takes place first and then gas production takes place. These changes are taking place in decomposing body simultaneously. But for the efficiency of learning, I have divided it into color change and then gas production. Why does gas production take place? Gas production, that's also due to bacterial activity. As bacterial activity takes place, there is release of bacterial enzymes, and then there is reduction of protein and carbohydrates. This releases various gases like carbon monoxide, carbon dioxide, hydrogen sulfide, methane, ammonia, the hydrogen itself, and then mercaptans. Now the gases produced in the body, they are going to go and deposit at various sites within the body, and depending on where they go and deposit, various changes are appreciated. So let's see where these gases can go and deposit and what type of changes they bring about. First, number one, they will deposit in the intestines, obviously intestines. As a result, the abdomen becomes distended, and the abdomen also becomes tense. Number 2, they will go and deposit in the eyes. As a result, the eyes become dissolved and there are changes in the cornea. There are two specific changes in the cornea. Number 1, it becomes white, and number 2, it becomes flat. Normally, when you look at the side view of the eye, here's the sclera, and then there's a bulge of cornea and then sclera again. But then due to deposition of the gas, the cornea becomes flat. Then the gas can go and deposit in the mouth, which forcefully pushes out the tongue, resulting in tongue protrusion. Then the gas can go and deposit in the abdomen itself. Sorry, before abdomen, the gas will go and deposit in the skin, resulting in peeling of the skin plus blister formation in the skin. It can go and deposit in the abdomen, which results in post-mortem purge. What is post-mortem purge? See, in a decomposing body, you might be able to appreciate bleeding from nose and mouth. That is post-mortem purge. What is the reason behind bleeding from nose and mouth? As gas gets collected in the abdomen, it pushes the diaphragm up, which increases the pressure inside the thorax. Simultaneously, there is also deposition of gas in the thorax. So there is buildup of pressure inside the thorax. This increased over pressure inside the thorax results in rupture of pulmonary vessels. And the blood that leaks out after rupture of pulmonary vessels is pushed out of the nose and mouth. That is why there is bleeding from nose and mouth, but this might be confused with ante-mortem injury. So when you see a dead decomposing body, you might see that there is bleeding from nose and mouth, and you might think that the person might have gone through injury to the face, some kind of injury to the face leading to bleeding from nose and mouth, when in reality it is not due to any injury. It is due to buildup of gas and increase in pressure in the intrathoracic pressure, and that is increase in pressure inside the thorax, and that is referred to as post-mortem purge. So what is post-mortem purge? In post-mortem purge, there is gas accumulation in abdomen, which pushes the diaphragm up, which increases intrathoracic pressure. As a result, there is rupture of pulmonary vessels and blood leaks out. This blood that leaks out due to pulmonary vessel rupture is pushed out by the increased pressure in the thorax through nose and mouth, which is appreciated in the form of nasal and oral bleeding. And this is nothing but post-mortem purge. So you saw deposition in the intestine, eyes, mouth, skin, abdomen. What about internal organs? Yes, it can go and deposit in liver, leading to foamy liver. Then it can deposit throughout the body, leading to gas stiffening. Gas stiffening. See, gas stiffening is different to rigor mortis. It is one of the differential diagnoses of rigor mortis. Rigor mortis is true stiffening. Gas stiffening is not true stiffening. Rigor mortis takes place after death due to depletion of ATP in muscles. Gas stiffening takes place due to decomposition leading to accumulation of gases in the muscles. So, rigor mortis due to depletion of ATP in muscle, gas stiffening due to deposition of gas in muscles. See, with the end of rigor mortis starts decomposition, and with the end of rigor mortis there is also relaxation of the body called secondary relaxation. But as a decomposition goes on, as gas evolution goes on, as gas gets deposited in the muscle again becomes stiff. But this stiffness will be lost once the gas from the muscle leaks out. So what is gas stiffening? Gas stiffening is the stiffening of the muscle due to deposition of gas in the muscles. This is not true stiffening like rigor mortis, and gas stiffening is lost with the leakage of gas from the muscle as well. And there is one more concept that you need to know, that is coffin birth. What is coffin birth? Let's say a pregnant female dies. As the female dies, the fetus also dies because the circulation between mother and fetus is cut off. But the fetus is still inside the body of the pregnant female. Now, as the female goes through decomposition, the body of the female, the body of the mother goes through decomposition. There is accumulation of gas in the abdomen and increase in pressure in the abdomen. This increased pressure in the abdomen, it pushes against the uterus, and the baby gets pushed out of the uterus by the increased pressure in the abdomen. There is post-mortem extrusion of the dead baby. This is referred to as coffin birth. So, coffin birth is post-mortem extrusion of dead baby due to accumulation of the gas inside the abdomen, creating pressure inside the abdomen and pushing against the wall of the uterus after death as the process of decomposition and gas evolution is going on. Okay, now let's look at the pictures explaining each one of these changes. So, deposition of gas in intestine leads to abdominal distension plus abdominal becomes tense. Deposition of gas in the eyes leads to dissolution of the eye plus changes in cornea, where the cornea becomes white plus flat. Deposition in the mouth pushes the tongue out, so there is tongue protrusion. Deposition in the skin leads to peeling of skin plus blister formation. Deposition in the abdomen forces the blood from ruptured pulmonary vessels out of nose and mouth, called post-mortem purge. And deposition of gas in the muscles leads to gas stiffening, which is not true stiffening like rigor mortis. Deposition of gas in liver leads to foamy liver, and post-mortem extrusion of baby out of dead women, dead mother, due to deposition of gas in the abdomen, creating pressure against the uterus, is referred to as coffin birth. Okay. So with that, we are done with gas production as well. Then there's liquefactive necrosis. I think you know about liquefactive necrosis from pathology itself. Then there is something called maggot activity. What is maggot activity? Whenever there is dead and decaying organic matter, there's always flies around it. So if a dead body is decaying, there are going to be flies on that dead body as well. And the flies, they are going to lay eggs. So these are all what you see in white are the eggs of the flies. The eggs then hatch, and what comes out is the larva. The larva of the fly is referred to as maggot. So the maggot shows activity in the dead body, that's your maggot activity. Eventually, what remains is the skeleton. This is skeletonization. The skeleton either dissolves or is preserved in the form of fossil. You need to know about Casper's dictum. Casper's dictum gives us rate of putrefaction, which is 1:2:8 in air is to water is to land or soil. That is, if it takes X days for a body to decompose in air, for the same body to decompose in water would take twice the number of days, and for the same body to decompose in soil would take 8 times the number of days. That means fastest decomposition takes place in air and slowest decomposition takes place in soil. Under modified decomposition, You have preservation of the body by two ways. Number one, by adipose hair formation, and number two, by mummification. For both these processes, I'm going to give you individual flowcharts, and that flowchart will explain you everything you need to know about the process, from definition to mechanism to criteria to time taken to significance, every single detail. Starting off with adipose hair formation. Adipose hair formation. So adipose hair formation takes place from the fat, where the fat is broken down to fatty acid like palmitic acid and stearic acid. For this to take place, from your knowledge of chemistry, you must know that the process of hydrolysis plus the process of hydrogenation needs to take place. So the fat goes through hydrolysis and hydrogenation to be converted to or broken down to fatty acid. Now, where exactly are the fat present in your body? They are present underneath the skin, which is subcutaneous fat, and in your organs, referred to as visceral fat. It is the subcutaneous fat that is involved before the visceral fat is involved. What is the criteria for this to happen? Since there needs to be hydrolysis, obviously you need moisture. The climate needs to be warm, and there needs to be still air. Not flowing air, but still air. And what do you need for adipose hair formation? You need fat, so there needs to be fat. And number 5, for hydrolysis to take place, there must be an hydrolyzing enzyme like lecithinase. So these are not just the criteria, but also the factors that determine how quick adipose hair gets formed. That is, if there is these criteria fulfilled properly, then adipose hair formation will take place quickly. For example, if the environment contains lots of moisture and is warm, adipose hair formation will be fast. If there is still air, adipose hair formation will be fast. If there's a fat man with lots of fat in his body, adipose hair formation will be fast. If there's lots of lecithinase enzyme, adipose hair formation will be fast. Talking about fast, how long exactly does it take for adipose hair to form? So it's 3-3-3, that is quickest it takes 3 days, on average it takes 3 weeks, and it can take as long as 3 months. But we still have adipose hair to form. Come on, let's form that adipose hair. To this fatty acid, then calcium gets added. You know from your knowledge of chemistry that when sodium and potassium gets added to fatty acid, you get sodium and potassium salt of long chain fatty acid referred to as soap. So that is exactly what happens here. There is soap or wax like adipose hair formation. Soap or wax like adipose hair formation. Now the thing about this adipose hair is that oh no, yeah, it is acidic. That is, it has low pH, and this low pH inhibits bacterial activity, and hence it inhibits putrefaction or delays putrefaction, and this is how the body is preserved from being putrefied. The adipose hair itself is ammonical in smell. It is ammonical in smell. So look at the diagram right here. You can see this dead body is quite smooth and shiny. That is due to the formation of adipose hair, and it is preserving the body from getting putrefied and then skeletonized. Second preservation is mummification. Mummification, the process of dehydration, takes place way before or faster than the process of putrefaction. As a result, there is loss of all the water from the body. And how much of the body is water? 70%. So there is loss of around 70% of total body weight. And the body is quite shrunken. All that weight is lost, obviously the body is going to be shrunken. What's the criteria? Since dehydration needs to take place, obviously the climate needs to be hot and dry. Unlike adipose hair formation, where the environment needed to be moist and warm. In adipose hair formation, you required still air. In mummification, you require flowing air. The time is 3 to 12 months. You can see right here, this is a mummified dead body. You can see it has lost all the water from the body. It is completely dehydrated and shrunken. It has lost around 70% of its weight. Now, what is the significance of modified decomposition or preservation of the body? The significance is that due to the preservation of the body, it has medico-legal importance. Preservation of the body has medico-legal importance. For example, if you see that a body has adipose shear formation, you can guess the type of location the body was in. That is, the body might have been in water where there is lots of moisture, or in a warm area, or in an area where there is still air. Similarly, if you see a mummified body, you can say that the body was probably in desert where the climate is quite hot and dry. And then another thing is that since the body is preserved, that means all the injuries, marks, identification criteria are preserved along with the body. They are not destroyed by the process of decomposition. So that is also medico-legally important. Okay, after modified decomposition, there are two concepts, small concepts that you need to know. One is odor mortis. Odor mortis refers to the release of pungent odor from a decomposing body. So rescue dogs, they smell that pungent odor and then try to find for the decomposing body or the dead body. Second is post-mortem luminescence. This is the glowing of the body due to the infestation of the body by photobacterium like Photobacterium fisheri or fungus like Armillaria. And with that, we are done with post-mortem changes. We are done with the movie. See you next time.